This is my 3-month post-op update, comparing our before and after photos from pre-op to post-op to healing and now. As I've spoken a lot about the medical and functional reasons why I had made this decision, I feel like now at 3 months is the time when I can kind of see my face returning again. So let's talk about it while I do my makeup.
I've just been focusing and trying to focus on how much better I've been feeling physically and how I've been able to breathe and see so much easier. I definitely wanted to be real and honest with you, and I didn't want to just disappear during my recovery time and not film or upload content just to hide my process and my healing. I wanted to talk about my experience and not just reappear after all the swelling goes down and glamorize this whole process. I definitely also understand that people who do hide this period may want to do that because of the perpetuated stigma against cosmetic procedures, but I do think it was the responsible thing for me to do to show you what the process does look like. In every growth and healing journey, I think there's always a bit of regret and guilt or second guessing involved. We just sometimes don't know when we're in pain and when we're in the tough times if the decisions that we made were the right ones. And I had to just put a confident foot forward and trust myself and my decision, trust my 3 years of research and my loved ones' encouragements. And sometimes the journey is more important than the actual end outcome, and it's definitely more important than the temporary pain. However, now that a lot of the swelling has been reduced, I can see more of the aesthetic and visual effects my operations have had on my face and on my individual features of my face. My eyes definitely bring the biggest difference to my face, I believe, just because my eyelids were so droopy before my ptosis correction that once I had all the excess skin and fat that was obstructing my vision removed, you can see so much of my iris, so much of my whites of the eye, and I did have to change my makeup application technique in order to avoid my incision area, but also just to balance the overall eye shape of my eye out. Previously, I was doing my makeup mostly on the upper outer corner of my eye because that's the only visible eyelid space that I had. These are some before and after pictures of pre-op as well as during healing and how my face looks now. I think with makeup, I definitely look a lot similar before and after just because my techniques create more definition and balance to my face. I also wanted to show you my scars up close. This is something that I hadn't really seen much of when I was doing my research for the last 3 years. My stitches were removed 2 weeks post-op, and now we're at 3 months post-op. My skin is still a little bit sensitive in the incision area. I do try to avoid putting makeup on my actual incision, however. For my nose, I do notice that I don't have to contour my nose as often anymore because there are natural shadows that appear with my balance of my nose now. I've actually been finding that I'm using less makeup in general due to the balance and symmetry that I usually did use the makeup to achieve. I feel like my nose is a perfect fit to my face, and these are my before and after photos for my nose, and I also wanted to show you my scars as well for my nose. I do have to clean my nose with cotton buds right now because of some of the more internal swelling, but I actually do prefer this method over blowing my nose, which I still do find painful. Dr. Lee at banobagi had told me the mid-face of my facial balance between my eyebrows and my nose is actually slightly longer naturally and is the longest amongst the 3 proportions from the forehead versus the nose to chin. Dr. Lee informed me that creating a taller nose will create more visual distance between my forehead and my lips. In order to prevent that from happening, he had only placed the thinnest eye-shaped silicone to straighten the crook that I had and balance everything out overall. And I think this is so true. It really helped to balance everything out, and I don't feel at all that it was too tall, because that's something that I was worried about. If I were to have anything in my nose, I didn't want it to look unnatural. Now for my cheeks and jaw, I definitely have the most swelling here. And visually, I think at this point, it's returned to the same size as my previous face, but with just a rounder shape in general. These are the before and after photos, and surprisingly, the scars are actually in the mouth on the gum line. They do look really scary right after surgery. I was actually instructed not to look at my stitches, but I did take a look. They said you shouldn't open your mouth and look, but I did, just like twice. But now I can do it without as much pain, as closed up really well, as you can see. Most of the correction in my cheek and jaw was to balance out the symmetry throughout my face, especially my right cheek was protruding a lot more than my left, and my left jaw was much thicker and denser than my right jaw. I believe this may be due to side sleeping, and I did mention in previous content, I grind my teeth at night. I clench my jaws quite often. I also started chewing on the left side of my mouth the last 4 or 5 years or so due to pain on my right side from my night guards. It's very, very subtle and only needed mild asymmetry correction, as Dr. O from Banobagi let me know that in many severe cases, they would have to completely shift the lower jaw in order to straighten everything. But he didn't have to do that in my case. Whenever I do wash my face or do my makeup, I can feel and see that the symmetry has improved a lot. And a lot of my oversized muscle on my left jaw was also reduced, where I previously did have 2 times the amount of muscle relaxant on my left than on my right after my extreme jaw clenching and teeth grinding from after my tonsillectomy. Dr. O actually had also told me that he removed some excess fat under my chin. I think I definitely had some cheek and chin fat that did not go away with weight loss, and I even did have more cheek fat on my left side as well, I think also due to side sleeping. I previously had this fat on my cheek and my chin melted with fat dissolvent, but even then, Dr. O still told me that I have quite a bit of fat under my chin after the dissolvent. I think aesthetically, this really helps to create more focus to my face and bring more of the focus of my face up to my eyes. Speaking about face swelling, I did also see Dr. Barn, who is in charge of dermatology at Banobagi. I had some laser treatments with my coordinators who speak perfect English, plus the translators, so I had no worries of language barrier, especially while Dr. Barn was explaining to me the technicalities of the dermatology treatments and laser treatments at the clinic. He used a 2-phase treatment called 10 Farah with 2 different cartridges, focusing on the lower part of my face first, which had a lot of swelling. These are some photos from right before my dermatology and right after the dermatology. You can see how much of a difference this laser made, not only with the swelling, but he said that this laser treatment is super effective for slimming the face. Dr. Barn informed me that other clinics usually just do 1 phase of this laser treatment, but his second treatment combined with the first treatment makes a more efficient and faster, effective result. I went under deswelling laser as well, which is what they give you complimentary after your procedures. I fell asleep and I was snoring during this time, which I was kind of embarrassed because my translators were still in the room with me. But I am finding myself falling more in love with how balanced, symmetrical, functional, but still characteristically me my face is becoming as the swelling goes away. We're still only 3 out of 24 months of healing, but I do feel like I've got the hang of my routines for skincare, for my makeup, and new hygiene routines as well. I do have to use a more gentle touch due to the sensitivity of my face, but I do feel my nerves returning. Dr. O had informed me that some people do lose their sensation in their jaw after surgery if the doctor is not careful with avoiding the nerve lines. He showed me photos of my x-rays and my scans that indicated where my nerve lines are, and he let me know that he actually avoided these areas on purpose in order to preserve a lot of the nerves there that could be severely damaged if you're not careful. That's why it's so important to do your research and go to accredited hospitals that you know have a good reputation due to, your health is on the line here. I also had to change the type of masks I wear because my ear cartilage where I had my scar was very painful when I was wearing tight masks, and I just made sure that the blue medical mask that I was using was the loosest possible, as well as pinching the top wire on the nose to make sure that it's not going to press down on my nose, and wearing it a little bit higher up.
I will be replying to as many comments as I can under this video, so please let me know if you have any thoughts or questions. I will see you next time. Bye bye.